Having people to talk to when you've got early signs of dementia can be a great comfort, especially if those people are trained to help with thinking difficulties. The North Staffordshire Mental Health and Wellbeing Service provides cognitive behaviour therapy to people over the age of 50 with vascular risks and mental health problems. It's a primary care service which enables patients to talk more openly and to develop strategies to help them cope with their symptoms.
Together, we were looking at how to use diaries as a prompt.
I rely on it, but I also make mistakes. I forget to put things in sometimes.
So are you able to tell yourself, David, it's not my fault, it's...
Well, no, you feel a bit ashamed of yourself because you've let people down, and I hate it. Because I didn't used to be like that. I was fairly relaxed. Feeling that you're not on your own is very, very important. And you hear how other people have members of their family helping them in certain ways, and you get good ideas that you hadn't thought of yourself. And so the business of meeting up once a month is a big help.
There can be a sense of blame, or it's my fault, or the significant partners can feel that they should be doing something about it. And once that's hidden factor is revealed in the jigsaw, it changes everything for that patient, and tailored support can come in.
The emotion that you elicit when you get that moment when you can't remember is anxiety, would you say? Or?
Well, certainly anxiety, but I think anger as well. I get really annoyed with myself.
Oh, I can do that, yes.
Well, you've told us about that at the meeting, haven't you?
Yes.
But I spend hours looking for things as well. You know, I forget where I've put stuff.
The patient is already working with us on their own formulation of what may be their experience. So they're actually beginning to process themselves what the problem might be and why it's beneficial for us to explore that. And that's the key really to the sensitivity of this, that there is potential for us then to discuss that.
People think they understand, but they don't. I know that I can talk to you, and I know that you will understand without being just sympathetic. You'll do it because you're trying to help me. In fact, you have helped me. Oh, so much.
We're not making assumptions, we're doing it as a positive. It's giving hope and planning and prevention as well.
A lot of the symptoms of dementia, if you like, can sometimes be misidentified as a natural consequence of growing older, and it can be missed. But if we're able to highlight these things early on, like Gwyn and Lisa are doing, then there is hope for the patient, because then they know that there is a reason or a basis for their symptoms, and it's not hopeless.
Now, I have learned about what is causing my problems. That alone helps me cope with my problems. I am not going down the slope I thought I was going down, though I do feel I'm going down some sort of a slope, but not the one that I dreaded.